appropriate bin immediately. Then, wash your hands with soap and running water to help stop the spread of germs.
To avoid getting the coronavirus, remember to wash your hands thoroughly and frequently before and after preparing food, after using the toilet or changing a diaper for a baby, sick person, or the elderly, after blowing your nose, and after leaving large gatherings or moving away from persons who appear ill. Encourage others to wash their hands and also use an alcohol-based hand sanitizer of 60 to 70% solution. Stay away from events having large gatherings of people. You can expose yourself to more possible infections in large groups. Also, avoid sharing cutlery, cups, glassware, etc. with others. Viruses can linger on these items and may be transferred this way. Avoid shaking and holding hands, and hugging or keeping an infected person in close proximity. This is a message from the Ministry of Health and the National Emergency Management Agency, NEMA.
When you feel a sneeze or a cough coming, try to prevent sneezing or coughing into your hands, as this will contaminate your hands and spread germs. Covering your mouth prevents the spread of germs. You probably knew that, but the way you cover up also matters. And that means breaking a habit you've done all your life. Cover your mouth and nose with flexed elbow or a tissue, not your hands. Discard the used tissue in an appropriate bin immediately. Then, wash your hands with soap and running water.
Is on.
Good day and welcome to the NEOC COVID-19 briefing for today, the 7th day of January 2022. Thank you very much for joining us. This is our first briefing for the new year, and I take this opportunity to wish you a bright and prosperous new year from the National Emergency Operations Center. Today I want to recognize the Prime Minister, Dr. the Honorable Timothy Harris. I also recognize the Permanent Secretary in the Ministry of Education, William Vincent Austin Hodge. We continue to bring you updates with what is happening in the Federation of St. Kitts and Nevis in relation to the COVID-19 situation. Since the new year has begun, we have been following the trend of what is happening in terms of rising cases of the COVID-19 virus in the population. We continue to thank you for paying attention and playing your part in adhering to the non-pharmaceutical measures and to take the time out to go and get vaccinated, those who are eligible to do so. I want to first invite to the podium our Chief Medical Officer, Dr. Hazel Laws, who will present us with the Health Emergency Operations Center report for today. Dr. Laws.
Thank you, Mr. Williams, and a warm good afternoon to everyone. It's my task, as per usual, to share with you the Health Emergency Operating Committee's situation report for today, Friday, January the 7th. But before I go into the report, it's our first press briefing for the year, and I want to wish us a prosperous and a near normal 2022, despite the context of the COVID-19 pandemic. So Happy New Year to all of you. This first slide provides us a snapshot of the COVID-19 situation on the ground here in the Federation of St. Kitts and Nevis. To date, we have we have reported a total of 3,904 confirmed cases of COVID-19. We continue to enjoy an excellent recovery rate. So to date, 2,946 recoveries have been documented, and so we are monitoring 930 active cases, with 108 active cases being monitored on the island of Nevis and 822 active cases being monitored here in St. Kitts. And we are pleased to note that we've only recorded 28 COVID-related deaths, and we have had no additions to that tally, that aspect of our tally. Now, in terms of hospitalization, at present, we have 9 COVID-19 cases in admission, 1 at the Alexandra Hospital, and 8 admitted at the JNF General Hospital COVID ward. So we are presently containing or trying to contain the 4th wave of COVID-19 infections. Based on data from the Health Information Unit within the Ministry of Health, this 4th wave begun round about Christmas Eve, the 24th of December. And so we are 2 weeks into this 4th wave caused by the Omicron variant of concern. And so within this period between December 24th to January the 5th in particular, we've added, in that time period, we've added 844 cases. And so the epidemiologist, the statistician, we are in the process of analyzing the data on these cases that we've just added. And the data is still being collated, but so far what we can say is that 54.5% of the cases added in this period are vaccinated, and 7.7% not vaccinated. But you realize we are still trying to ascertain data on about 38% of the cases. Now, when we look at the experience of these cases, meaning the disease, how are these persons impacted? 52% are experiencing symptoms, and about 21% no symptoms. And again, not all have provided us the data that we are trying to get from these individuals. But it's very important to note that despite the high number of cases, we've only had 11 hospital admissions in this window. And so the hospitalization rate continues to be acceptably low. And again, no deaths, no COVID-related deaths have been added in this time period. And I mentioned the recovery rate, and within this short period, we've already had 148 persons recovering fully. Now, of these recoveries, 80% were fully vaccinated, and 20% of these persons who recovered were unvaccinated. And so it tells us that those who are vaccinated, their disease experience has been mild, and they recover fully in a relatively short window of time. And the average number of days to recovery, for now, we are deeming it to be about 7 days. And so we looked at some data coming out of the United Kingdom, whereby they looked at the vaccine effectiveness, and the vaccines they focused on were the AstraZeneca Oxford vaccine and the Pfizer-BioNTech, which is similar to the two that we've been offering here. And what's the vaccine effectiveness against hospitalization? And this study showed that what they did, they looked at the risk of hospitalization amongst those vaccinated versus those unvaccinated. And they found that persons who received the 2-dose primary series up to 24 weeks, 6 months after the second dose of receiving the vaccine, there's a 6 to 7% risk reduction in hospitalization. And those who would have received the second dose over 25 weeks before, there is a 51% risk reduction in hospitalization. And then those who were only partially vaccinated, meaning only 1 dose on board, they enjoyed a 35% risk reduction in hospitalization. And then when you look at those who received the booster dose, so 3 doses, the 2 primary series, the 2 doses, the primary series and the booster, there was a 68% risk reduction in terms of hospitalization. And so what this is underscoring is that the COVID-19 vaccines, the AstraZeneca Oxford and the Pfizer-BioNTech, still provides us adequate coverage in terms of the prevention of moderate to severe disease, hospitalization, and the possible eventualities. And so again, just underscoring the importance of vaccination. And so I just wanted to share that with the general population. Now, the case managers who are following up, monitoring the cases, they share this information with us in terms of what are the common symptoms being experienced by the individuals who have been impacted by the COVID or the Omicron variant of concern. And so the most common symptoms, headache. Almost everyone, I had a headache, an unusual headache. Some complain of coughing, some complain of nasal congestion or stuffiness of the nose. Some complain of malaise, fatigue, runny nose. And what we are noting is that it seems to have a shorter incubation period when you compare it with the Lambda variant and the original strain of the virus that we were exposed to in 2020. The incubation period is now round about 3 days. So you're exposed to the virus, and within about 3 days you exhibit some of the symptoms that I just explained. So these are the common symptoms that the cases are sharing with the case managers and the physicians who provide care for them. In terms of our vaccination program, we continue, and it's even based on what I just shared, it's so important for us to continue. So to date, 81.6% of the adults in the Federation have come forward and received the first dose of the COVID-19 vaccine, and 76% of the adults in our population are fully vaccinated. And in terms of the older adults who have come forward to receive the booster, 6.4% of the adults have done so. And so we want to pause and reach out to the elderly, the older adults with the chronic conditions, those who are in nursing homes, in the prisons. Please feel free, walk into any of the health centers during the time slotted for vaccination and request your booster. In terms of the teenagers, 12 to 17 years, 16.8% have come forward, and their parents provided consent for them to receive the first dose, and 14.4% are fully vaccinated. And now that we are, thinking about the commencement of the second semester of this academic year, this comes to the fore. And so we want to reach out to parents, guardians, teachers, auxiliary workers in the schools. And we are talking the early childhood, those in the early childhood sector. We are speaking to those in the primary schools, secondary schools. We want you to empower yourselves in terms of the safety of the vaccines and the need for you to contribute to the safety in our schools such that our children can enjoy that face-to-face learning experience that they've been accustomed to. Now, when you look at the total population, 54.7% of the total population fully vaccinated. That's good, but then on the flip side, it tells us we still have work to do in terms of bringing on board the other adults and teenagers in our population in terms of vaccination. And this table shows the data disaggregated, and so you realize that NEVIS, our adults and our children in NEVIS, we want to pause and reach out to them in terms of, they're lagging behind. So in terms of SYNCITs, 79.6% of the adults in SYNCITs are fully vaccinated. In NEVIS, it's 66.7%, and we really want this gap to be closed. In terms of our children, the teenagers, 15.2% of the teenagers SYNCITs are fully vaccinated, 12% NEVIS. Again, we really want this gap to be closed because we really don't want to see an outbreak where the gap lies. What's the way forward? Vaccination program. It continues. And within the Ministry of Health, we are targeting the vulnerable persons in our communities. And so the community health workers, we are trying to reach out to the older adults in our communities, those with diabetes, hypertension, kidney disease, heart disease. If you've not yet come on board in terms of receiving the vaccine, we want you to do so. Again, we are focusing on the teenagers, the 12 to 17-year-olds, because we want our secondary schools to be safe. We really want our secondary schools to go back to full face-to-face learning. We want to reach out to the young adults, those in terms of the ballers, the basketballers, those in the athletics, the various sporting disciplines, to come on board in terms of receiving the vaccine. And then most importantly, our essential workers. From our perspective in the Ministry of Health, we realize that the Omicron variant is spreading, it's moving rapidly through our population, and it's impacting our essential workers. So right now, a number of persons in the police force are impacted, a number of healthcare workers are impacted, and so again, it's reason for us to pause and consider, where we are at in terms of vaccine hesitancy and recognizing our vulnerabilities if you are not yet vaccinated and coming on board and receiving the vaccine. So we need to keep up the momentum in terms of our vaccination program. In terms of testing, the Ministry of Health, we are conducting mass testing, and the aim is really to identify those positives amongst us and then have them isolate, because then in so doing, you can keep the total number of those impacted during this wave at its lowest. It's one way of flattening the curve. And also, very importantly, it is reducing the demand on the hospital and the emergency room. And so it's important, if you are experiencing any of the COVID-like symptoms, I'll go on to explain what these are. Well, I did already. We want you to capitalize on the opportunity for testing. The next slide provides that information. All right, and so on Tuesdays and Friday mornings between 6:30 and 7:30 a.m., if you're experiencing any of the COVID-like symptoms, you could just come forward and be tested. On Wednesday mornings, you can go down to the Poxon Hospital car park, 6:30 to 7:30, or on Thursday mornings to the Mary Charles Hospital, 6:30 to 7:30, and you can have your swab taken. In terms of NEVIS, I have been in discussion with Dr. Judy Nisbet, and we are exploring the options of mirroring this in NEVIS. In terms of contact tracing, isolation, quarantine, we continue. At present, the contact tracing process is aimed at containing clusters in the families, social groups, social networks, and within workplaces and communities. And we want to pause and ask those who are diagnosed with COVID at this time to really isolate, adhere to the isolation order, and the close contacts of these individuals. We want you to quarantine and adhere to the COVID-19 prevention and control measures. And these are wearing the face mask at all times. So even more now than ever. Omicron is very, very contagious. You don't really have to interact very long with somebody who has it to catch it. And so the wearing of the face mask is so important. Some of the literature said if you're using a cloth mask, probably you need to double the cloth mask to give you that additional layer of protection, because Omicron is so contagious. But most importantly, you're out in the public domain, keep on your face mask, maintain adequate hand hygiene, sanitize your hands after leaving the supermarket and pushing the trolley or lifting up the cart. You're going to the bank and you've touched the counter in front of the teller. Make sure to sanitize your hands before and after. Keep your hands out of your face and mouth. In terms of adequate distancing, very, very important. Maintaining that safe space between yourselves and others, and avoid crowds at this time. Again, Omicron variant is highly contagious. You don't really have to interact too closely with an infected person to pick it up. So please do all you can to protect yourself. And if perchance you're experiencing any of the symptoms I mentioned, please stay at home. So do not go to work, stay at home, and help us to contain this wave. Thank you.
Thank you very much, Dr. Laws. I want to recognize the Honorable Wendy Phipps, the co-chair of the Disaster Mitigation Council, the Cabinet, and also the Honorable Jonelle Powell, the Minister of Education, who both have joined us. I now want to call Dr. Cameron Wilkinson, the Medical Chief of Staff at the Joseph N. France General Hospital, to make a presentation.
We made a decision to relax restrictions as we move forward in the management of COVID-19 and learning to live with the virus. On this journey, we should understand that any decisions to relax restrictions are not without risk. That is why very early after making the decisions to remove the quarantine period and the barrier at Port Zante, which were necessary to revitalize our cruise industry, overall visitor arrivals, and generate economic activity, we said a fourth wave was inevitable. We also said that we were not helpless and that the fourth wave could be less severe and less deadly if we gave ourselves the best protection with the vaccine. We should therefore not be alarmed nor panic as the number of positive cases have risen with the progressive relaxation of our entry requirements. Zero COVID is neither advisable nor desirable at this stage. The cost of zero COVID could have more devastating effects than the virus itself. Zero COVID involves border closures, curfews, and extended lockdowns with significant disruption of every aspect of our lives and livelihood. We are way past those measures in the management and containment of COVID-19 that were implemented earlier on, as we have weapons now to fight this deadly virus. We are dealing with an unprecedented crisis for which there was no precedence, but we have learned a lot over the last 18 months. We know that if you are vaccinated and boosted and are wearing an appropriate mask appropriately, one, your risk of getting COVID is very low, but that you could have a breakthrough infection. Two, if you do get infected, you are less likely to transmit the virus as you will have a low viral load and be infected for a shorter period of time compared to someone who is unvaccinated. And three, you are most likely to have asymptomatic or mild disease and recover without having to be hospitalized. Vaccines and boosters are protecting our people from severe disease, hospitalization, and death. Vaccination, therefore, still remains the key. We will still be fighting COVID next year if we do not get more people to do the right thing today. The sharp rise in cases in the fourth wave from Omicron is not a surprise to us. With this variant being highly transmissible, this will be the case in any country, but where people remain vulnerable without the protection through vaccination, the results could be deadly. This current situation emphasizes the importance of the non-pharmaceuticals and more so the vaccination. It's our high vaccination rate among our adults that is protecting us. We started the fourth wave on about December 24th. We, as of yesterday, had 930 active cases. During that period, we have had 146 recoveries so far in this fourth wave, recording a total of 63 recoveries just yesterday, 26 and 34 the two previous days. And we are currently testing 102 persons for recovery today. Over this period, you heard that we've had 7 hospitalizations in St. Kitts and 2 in Nevis and no added deaths. We thank God for that. The patients who are hospitalized are for the most part stable, and we are not seeing the severe respiratory problems that were experienced in the previous waves. The Omicron variant is in circulation and is most likely driving up our numbers. While hospitalizations sometimes lag behind cases, the low hospitalization rate due to COVID, which is an indication of disease severity, reflects the following, or may reflect the following. 1, the protection conferred by the vaccine. 2, some degree of immunity from previous infections. And 3, that Omicron is not making people as sick as the previous variants. With our high population threshold of immunity, it is highly unlikely that hospitalization numbers and deaths will ever rise to the level seen in the previous waves. Data from countries that have been experiencing a fourth wave suggests that the unvaccinated are hospitalized at a much higher rate than the vaccinated. As we move through this wave, our healthcare system could still be threatened if more unvaccinated persons get infected and if we do not protect our elderly, even if they are vaccinated, as a mild illness could push them over the edge. We are entering year 3 of this pandemic, and we're going to have to learn to live with COVID-19 because it's not going to go away just now. We are going to have to stop focusing on the overall positive numbers and move forward making sure our hospitalizations and deaths remain low through vaccination and the use of the non-pharmaceuticals. There are 3 critical groups, which you heard earlier, that we need to target: our children between the ages of 12 to 17, our young adults who frequent the nightclubs, and school children. They cannot stay out of school for another school year. The negative psychological and social effects from the lack of socialization, coupled with the adverse effects of remote learning on their educational progress, will be devastating to this generation of children we have. You will hear later on in the presentation from others about the details of school reopening. We, however, cannot have a child stay out of school because he or she may be positive. And so going forward, we'll need to do more testing to have children stay in school. It makes no sense closing down schools for an entire term for a disease that will most likely keep a child ill for 5 to 7 days. Every school teacher entrusted to care for our children should be vaccinated. They should be part of the solution and not the problem. We should do all we can to have a safe opening of our schools and attempt thereafter to keep them open with testing, vaccination, and the use of the non-pharmaceuticals. As it relates to our young adults, we need to continue to try to get them out to be vaccinated and to respect the use of the non-pharmaceuticals employed to contain the virus. We all want to benefit from good public health, and we all should contribute to it. We all need to be personally responsible in this fight. We should not, for example, apply to have a brunch for 100 persons, then use that permission to have a BRAM for 500. We may have to put these events on hold if the organizers of these events are dishonest and not sticking to the protocols, and I'm sure you'll hear more about this from Cromwell when he presents. These mass events can be super spreaders and further put stress on the healthcare system. As it relates to our essential workers, we cannot afford to have essential workers who choose not to get vaccinated. They leave themselves vulnerable to every single variant that arises and become a vehicle for transportation of the deadly virus and endanger the lives of those who depend on them for essential services. I believe every essential worker should be vaccinated. If you are an essential worker and care about the people who you care for and your colleagues with whom you work, you should do the right thing and go out and get vaccinated if you are not. Finally, COVID-19 is still a serious disease, despite the fact that you hear that the Omicron variant may not be that severe, more so for the unvaccinated. And if we are going to make any progress, we'll have to get those who are unvaccinated vaccinated. So I end by again making the same plea that I've been making for several months. Please go out and give yourself the best protection there is against this deadly virus, which is to be vaccinated. And if you're due for a booster, you get your booster. Thank you.
Thank you very much, Dr. Wilkinson. I now invite our Superintendent of Police, Superintendent Cromwell Henry, to give us his presentation.
Thank you very much, Mr. Williams, and a pleasant good afternoon to all listening to this broadcast. As the Honorable Attorney General announced at our last press briefing, the state of emergency expired on December 31st. This means that no new COVID-19 emergency regulations will be published. Instead, regulations under the COVID-19 Prevention and Control Act were published and became effective from the 1st of January 2022. These new regulations encapsulate all the critical provisions of the last emergency powers regulations. Our response to COVID-19 will therefore be mainly guided by the COVID-19 Prevention and Control Act and its regulations. Section 9 of the COVID-19 Prevention and Control Act places restrictions on social activities and requires persons intending to host such activities with more than 25 attendees to seek written permission from the Commissioner of Police. Activities requiring permission include private parties, banquets, balls, receptions, meetings, and any other type of social event. With an average of almost 200 new COVID-19 cases daily, we can appreciate the need to limit the type of social activities that will promote the spread of the virus. We therefore ask that you give consideration to the type of social events that you are planning and ask yourself whether or not the event will expose your guests to increased risk of infection. And if so, adjust your plans. Section 12 of the Act permits anyone to visit a public beach, but only for the purpose of swimming or exercise. There should be no picnics, beach parties, or other gatherings on the beach. Persons using the beach should adhere to the social and physical distancing protocols. Section 11 outlines the guidelines for persons attending weddings and funerals. These should have a maximum duration of 1 hour. The seating arrangements should allow for a maximum of 6 feet between persons. Distance markers should be placed to indicate where each person should sit. The total number of persons permitted to attend inside of the building is 1 person for every 30 square feet. In other words, the larger the building, the more persons will be permitted inside. Persons attending these events should adhere to all the other protocols, wearing a face mask and the practice of good hand hygiene. Bars and restaurants are permitted to operate for the purpose of food takeaway services as well as in-dining services and for the sale of liquor in accordance with the liquor license. Persons patronizing these establishments should adhere to the physical and social distancing protocols, hygiene protocols, and the wearing of face masks covering the nose and mouth, except when eating or drinking. And this also applies to the staff. Section 10.4 makes provision for churches. All religious places of instructions or worship may open in accordance with the provisions of this Act and any other conditions or directives given by the National COVID-19 Task Force. The following persons should be encouraged to connect to virtual church services from home or may attend a separate early morning service designated for that purpose. Senior persons, persons in the pre-retirement age range, or persons over the age of 65 years old, persons with underlying health conditions, individuals with disabilities, and those who might not be able to wear a mask for the duration of the service. In closing, I want to make a special appeal to everyone, in light of the current wave of COVID-19 infections, that you make every effort to adhere to all the prevention guidelines outlined earlier in my presentation and to curtail your social activities, those who plan them and those who attend, especially those activities where social and physical distancing protocols are difficult to adhere to. Thank you.
Thank you, Superintendent Cromwell Henry. I now invite the Honorable Wendy Phipps to make a presentation.
Thank you, Leslie. Good evening to everyone. It is my task this evening to bring a report from the Federal Cabinet based on a set of recommendations that would have been carefully thought out and deliberated upon by the COVID-19 Task Force on Tuesday of this week. Essentially, the task force, as part of its mandate, is charged with looking at ways and means by which and through which the people of St. Kitts and Nevis can remain safe and the spread of COVID-19 can be contained as far as possible. As a result of that, and in light of the spread, the rapid exponential spread of the Omicron variant, the task force would have deliberated on Tuesday along the lines of making assessments in 7 major areas in which we can be affected by the spread of the Omicron variant. And these areas are workforce disruptions, airline and airlift setbacks, the essential services that we are obligated to provide as a government, the status of mass events, the cruise sector, the hotel sector, and the status and direction of the economic recovery and rebalancing strategy to which the Honorable Prime Minister would have alluded during the budget address, and which I also would have alluded to in my own defense of that appropriation bill. And that, of course, is based on a project being led by the Ministry of Finance under the guidance of the international consulting firm Deloitte. At its meeting held today, the Federal Cabinet would have taken into consideration the various recommendations from the task force on these 7 areas. And I am happy to now report to you in pressy format the decisions that would have arisen. In terms of workforce disruptions, the Federal Cabinet would have taken on board the recommendations of the task force that as a result of the spread of the Omicron variant, it was necessary for us in the public sector to begin looking at contingency measures as a means of mitigating the risk and at the same time lessening the impact on the workflows within the civil service. As a result of that, a decision has been made that a broad-based committee comprising of the Human Resources Department, led by the Chief Personnel Officer, the CPO, with support from the Financial Secretary, and also with support and inputs, critical inputs from permanent secretaries and heads of departments, a process of contingency planning will be going into force immediately as it relates to workplace rotations, shift systems, etc., and which will be inclusive of the option to work from home in the case of those workers who are independent enough to be trusted to work on their own and require little or no supervision. Citizens and residents may recall that this is not a new practice. It is something that we would have had to put in place out of need during the front end of the pandemic. But the decision is being made to reintroduce this practice because in some instances there may not be multiplicity of staff members with the same types of skill sets, that enough redundancy would have been built into the civil service to ensure with satisfaction that when certain essential workers are out of commission as a result of COVID, their jobs can be easily picked up by others. So this is one of the recommendations that we are going forward with. Inclusive in that recommendation, as I would have hinted, would be contingency scenarios in terms of whether you have 10%, 25%, 55% of your workforce out of work as a result of infection or as a result of the fact that persons would have to remain at home or out of the work environment until their status has been certified if they are a contact of a positive case. Airline and airlift. This is an area that Cabinet recognizes we will be impacted from. We have already begun to be impacted by it, and it has to do with the fact that COVID-19 has taken a severe, has dealt a severe licking on our major source markets in North America as well as Europe. To be more specific, the USA and the UK. We would have noted that over the past several weeks or so, we would have seen an average of about 2,700 flight cancellations throughout the US, and there were others of similar note in the UK. At the same time, we are recognizing that some of these cancellations, or maybe most of them, would have been directly related to infection rates in the airline industry that would have then seen an absence of staffing or skeletal staffing to be able to check in flights, handle baggage, etc. As a result of that, recently we would have suffered the effects of this in the cancellation of the direct JFK flight to St. Kitts and Nevis because every single check-in clerk was out with COVID. So, of course, the flight had to be cancelled. Compounding this situation, Cabinet realizes that there are also wintry weather conditions in these temperate climates, so ice and snow are also affecting the reliability of our airlift into St. Kitts and Nevis, and by extension, delays associated with the return flights out of St. Kitts and Nevis. As such, the federal cabinet has mandated that a committee comprising of the ministries responsible for tourism, transport, aviation, and port services will meet to devise a plan whereby they would strengthen the communication with the airline sectors that we are serviced by to see how the impact can be lessened in any way, inclusive of perhaps alternate routines for flights, etc. And of course, we realize that to a certain extent, we are still going to be dependent on the human resource base in those territories, as well as climate issues over which we have no control. In terms of essential services, the task force would have also looked at this in comprehensive fashion in terms of the impact of the Omicron variant, for example, on our police and defense forces, our health sector workers, our elder care facilities, schools, ports, and customs employees, and even down to the level of our own government switchboard communication apparatus that is in place. As a result of that, a broad-based committee will be looking at the assessments in these sector areas to look to the same exercise as was mentioned earlier in terms of the rank and file of the civil service, and we will be looking to see how we can put contingency measures in place once individual ministry by ministry assessments are done, as well as agency assessments in the case of the security forces to see what we can put in place to mitigate these risks. And to give you an example, in the police force, we are being advised that we already have some 80 officers who are positive. In a police force that has less than 500 workers, this is a serious impact on them. And of course, several speakers earlier would have pointed to the fact that vaccination makes a big difference because those persons who are normally affected with breakthrough infections recover faster than persons who have not been vaccinated. The average in the police force, for example, with persons who are out as a result of COVID, would reflect a 21-day recovery for persons who are not vaccinated and perhaps 7 to 10 days for persons who are fully vaccinated. So there is an impact on that. In the interim, the Ministry of Health would like to remind all essential service providers of the imperative to be properly attired in personal protective equipment or PPE and to adhere strictly to the provisions for COVID-19 prevention and control. As I would have mentioned earlier, among these essential services that are provided by the government would be education services. And we recognize that this presents a considerable challenge for us as we continue to look at the increase in the rate of infection. However, I would now like to call the Minister of Education forward, the Honorable Jonelle Powell, to explain the federal cabinet's decision when it comes to education. At the end of his input, I will continue with the cabinet's decision on the remaining areas of impact. Thank you.
Thank you, Minister Phipps, and pleasant good afternoon to all. Allow me to use this opportunity to wish all a healthy and happy 2022. The Ministry of Education, under the advice of the Ministry of Health, and with the approval of the Cabinet, has decided that schools will resume for face-to-face instruction as follows. For the early childhood sector and fifth form students in our secondary schools only on Monday, 10th January. And for primary schools, secondary school students in forms 1 to 4 and AVEC on the Monday, 24th January. I'll repeat. For the early childhood sector and fifth form students only in our secondary schools on Monday,
10th January. And for primary schools, secondary school students in forms 1 to 4, and AVEC on Monday, 24th January. The Clarence Fitzroy Bryant College has already announced that it will not be resuming until January 24th. All fifth form students and their respective teachers will report on Monday, 10th January. These students are in the process of preparing to write CXC examinations, and at this critical juncture require face-to-face instruction. Therefore, the main objectives during this 2-week period are to ensure that these students are able to complete their SBAs and remain on target for the completion of the CXC syllabus in time for the exams, which are scheduled for May of 2022. Fifth form students at the Bastia High School and the Washington Archibald High School are expected to report for full day sessions for the 2-week period. When Forms 1 to 4 report on the 24th of January, these 2 schools will revert to the shift system as per the first term. All ancillary staff within the secondary schools are required to report to work on Monday, 10th January, to facilitate the maintenance of school grounds, cleaning and sanitization of spaces, and the security at the school entry points. School offices will remain open with a skeleton staff so as to answer questions or facilitate the collection of educational material. All staff members will be guided by the Office of the Chief Education Officer and their respective principals. Primary school students and secondary school students in Forms 1 to 4 will remain at home and engage in revision until the 24th of January. During this period, teachers within the public sector are required to communicate with their respective principals and ensure that parents are apprised of the revision work and exercises that are to be completed. Parents, please be guided by your teachers regarding the submission of any work. The Ministry of Education is formulating a secondary pool of retired and part-time teachers and ancillary staff to provide support should we suffer a COVID-19 outbreak amongst our school staff after we resume schools. Private early childhood facilities can contact the Early Childhood Development Unit for further guidance and support. Similarly, private primary and secondary schools can contact the Office of the Chief Education Officer for further guidance and support. I reiterate what I said in an earlier statement today. Since the start of the new wave of the COVID-19 cases, several students and teachers have been infected. Both students and teachers are again encouraged to properly wear face masks, wash or sanitize hands, and to avoid crowds where possible. The ministry also urges parents to have their children ages 12 to 17 years old vaccinated at the soonest possible time to provide an extra layer of protection. The ministry believes that the health and safety of all students, teachers, and staff must be given top priority. However, it also holds the view that the continuing education of our students is paramount. And before I leave, I will just repeat the schedule for the resumption of schools. For the early childhood sector and fifth form students in our secondary schools only, on Monday, 10th January. And for primary schools, secondary school students in Forms 1 to 4 and AVEC on Monday, 24th January, 2022. Thank you.
Thank you, Minister Powell. I will now resume with the decisions arising from the meeting of the Federal Cabinet today, January 7th. As I would have indicated at the front end of this Cabinet report, there were some 7 areas where the task force would have deliberated, as they had seen in their judgment, could become adversely affected by the rapid spread of the Omicron variant. So I now proceed to the remaining 4 areas. Among the other areas that would have been looked at would have been the issue of the convening of mass events. And we looked at this within the context of the fact that the COVID-19 task force would have been made aware by the leadership of the Royal St. Christopher and Nevis Police Force that for the month of December alone, some 521 applications for events would have been made to the office of the Commissioner of Police, of which some 353 would have been approved. By extension, for the month of January, a number of requests would have been put forward to the office of the Commissioner, and for some of these events, the numbers of patrons that would have been listed would have been in excess of 300. We are also recognizing that based on the spread that we have seen in the last several weeks in terms of the Omicron variant, that a number of our events that would have been held, direct events as well as fringe events associated with Carnival and post-Carnival, would have returned outbreaks or cluster outbreaks with those events. These include the Bubble Juve. They also include the Miss St. Kitts pageant. And they also include some private events, including some brunches. As the case is at the moment with these outbreaks in these various clustered events, the Cabinet has taken under advisement the guidance of the COVID-19 task force, and as a result of this, all mass events, applications, and approvals are now being reviewed by the Office of the Commissioner of Police, and in the event a decision has to be made that these or some of these events would have to be cancelled, the police force will duly notify the applicants and conveners or event organizers for these functions, since we prefer to err on the side of caution and not enable a situation like what we already see developing with some of the mass events. We would have also looked at the cruise sector and the hotel sector. And we would have recognized, as most of us would have gathered by looking at the news, especially international news, that the cruise sector is already beginning to be impacted by COVID-19 once more, after, in our case, just shortly resuming last June 2021. We would have noted, for example, that at present, at least 90 vessels globally are plying the waters with varying rates of infected passengers and crew members on board. At the same time, we have to follow our own guidelines that we would have put in place as a member state of CARICOM and under the guidance of CARFA, as well as our own local Ministry of Health officials led by the CMO, in terms of keeping our people safe, keeping our borders safe, etc. And as a result of this, and recognizing that there would have been a pre-existing arrangement in terms of guidelines for the cruise sector, the Cabinet has made a decision that both the Ministry of Health as well as the Ministry of Tourism and the St. Kitts Tourism Authority would be reviewing the established protocols as a matter of urgency with a view to ensuring that they meet the mustard test in terms of what is currently unfolding globally, especially under the impact of the Omicron variant. By extension, in terms of the hotel sector, a review would also be done in terms of the level to which that sector has been impacted by COVID-19. We would have also recognized that upon departure, a number of hotel guests would have tested positive, and of course, they would not have been predicting that this would have been a likely outcome of part of a vacation that they would have been planning for. So this is another area that we are also examining. By extension, the Cabinet is also has also decided to review the existing policy where we have now moved from a 24-hour quarantine to a non-quarantine environment, whereby we would have made a decision several weeks back that persons who had a negative test within 3 hours of arriving in the Federation and being fully vaccinated would not have required quarantine. This too is being reviewed by a special committee to, guided by the data, of course, to determine if there are changes that would be warranted to this change in quarantine policy that we would have put in place. And the final area that the Cabinet would have deliberated on today has to do with the issue of the supply chain issues that we are seeing globally within the context of our own economic recovery and rebalancing strategy coming out of COVID, led by the Ministry of Finance under consultancy guidance from Deloitte. This committee is being chaired by the Financial Secretary with support from the Ministry of International Trade, also from customs, etc., and we would have representation from the private sector. That committee begins its work in earnest as of next week. However, insofar as the issues of supply chain would be concerned, given that we are a net importer of food, the Ministry of Agriculture will also be part of this process. And among the various measures that we will be looking at would be the whole issue of support to our citizens and residents in terms of having assistance from agriculture with the production of small crops, if you have sufficient backyard space, to help us to improve our food security, also to ensure that nutrition is still a high priority for us, because as we very well know from the Ministry of Health, that in order for us to fight disease and infection, it demands consumption of a healthy diet. And since we have to rely on imports of food in order to meet our local demands, it stands to reason that the time has come for us more now than ever to look at how best we can sustain ourselves. At the same time, that committee will also be looking at various measures, including but not limited to the containment of port charges in spite of the dramatic spikes that we are seeing in the cost of freight, which has had a knock-on effect on the cost of goods here locally. So we will have more to share with the public on this particular committee. In the meantime, the work must begin now in terms of the mitigation measures that the Cabinet has put in place so that we can look at the best scenario to survive this latest fourth wave, which has presented itself to us in rude fashion by Omicron. However, before I close, I also need to mention two things. One, as a reminder to what Superintendent Henry would have indicated, in that we are no longer under a state of emergency as a result of the end of year, December 31st. From January 1st, we are now under special regulations coming out of the COVID-19 Prevention and Control Act. And to reiterate what he stated, most, if not all, of the provisions for protection and guidance relative to COVID-19 would be covered under the new set of regs that would have been issued for January 1st onwards. We are also intending to reach out to the private sector in terms of their own COVID-19 vigilance, their own mitigation measures in the workforce in case there needs to be contraction, that they too begin to have their own measures in place to respond to it. Mr. Superintendent Henry would have also alluded to regulations when it comes to churches. And yes, the Cabinet reiterates its commendations to churches in St. Kitts and Nevis, who for the most part have been very compliant when it comes to the COVID-19 prevention and control protocols. We wish to remind the churches that we are not out of the woods, and we expect them not to let their guard down, but to reinforce these measures for the protection of all, given how highly transmissible the variant that we are confronting is at the moment. I would also like to focus on the fact that in terms of the private sector, that we remind them that in as much as there are compliance officers provided to the COVID-19 task force and under the supervision of the National Emergency Management Agency. There are only 59 of these officers. So we really have to have a partnership approach in terms of policing the regulations and the various protocols, entry protocols into places of business, mask wearing, hand sanitizing, etc. But at the same time, we expect them to be proactive in the workspace itself, even if it has to call for a monitor or so forth, to be able to ensure that these protocols are being maintained to the highest level. I thank you for your attention.
Thank you very much, Minister Phipps, and equally Minister Powell. We now come to the question and answer segment. And the first question has to do with the PCR test. Can the PCR test differentiate between the COVID virus and the common cold?
The PCR test is specific for the virus that causes COVID-19 disease. If one wants to test for one of the influenza viruses that cause the common cold, then that's a different test.
The second question: is there any information showing the vaccination rates of teachers per education level? Alternatively, which level of the education system has the least vaccinated teachers?
While we don't have the exact figures to give you now, we know that every single teacher needs to do what is right and go out and get vaccinated. And so without giving you a percentage, the persons who are not vaccinated, they know who they are. As a teacher, you're an essential worker. You are entrusted to take care of the children. You cannot be a vehicle to transmit this virus to them. So we ask you to go out and get vaccinated.
Canada accepts a negative COVID test done within 72 hours or a positive test taken between 14 to 180 days prior to departure. That being said, would I need a negative test to leave St. Kitts still?
Very good question. In order to leave St. Kitts and Nevis via commercial air, one needs to have a negative COVID-19 test because based on international health regulations, technically you really shouldn't be on a commercial flight with a positive COVID-19 test results. So in short, if you're going to be traveling, leaving the Federation via commercial air, you really need to have a negative COVID-19 test result. Well, by extension, if you're going on a private charter or a yacht, you can leave, once the pilot consents, pilot and crew consents to taking you with your positive status, you can leave via a private yacht or a private charter. Yes.
This question is from Win FM 98.9 FM. what is the percentage of COVID positive cases to tests in relation to tests? In other words, the number of tests that you have done, what percentage is positive?
Yes, in the testing that we've been doing at the various centers that have been opened up, it ranges anywhere from 30 to 50%. And so we know that Omicron is highly transmissible, and we are seeing that play out in our community.
Okay, this next question. Thank you, Dr. Wilkinson. What is with this present fourth wave, the infection rate versus the recovery rate?
The fourth wave started on the 24th of December, and so today actually marks 14 days since we entered the fourth wave. So it will be difficult for us to give a true comparison of the infection rate versus the recovery rate. But in my presentation, I spoke about what has happened over the last 3 days, where 3 days ago we had 34 recoveries, then 24, 63 yesterday, and we had testing 102 persons for recovery today. And based on that trajectory, it appears that the recovery rate is going to be pretty high. And so when we come back here next week, we would have data from 7 days after the 14-day incubation period of the virus, and we'll be able to give you more definitive information. But I said before in a post that there appears to be light at the end of the tunnel. Omicron appears to be causing less severe disease. It doesn't mean that it cannot still threaten our healthcare system, and we still need to maintain our vigilance, and we still need to make sure that everyone who can be vaccinated or who should be vaccinated go out and get vaccinated.
Some clarity is needed in terms of the reopening of schools. Someone wants to know if the schedule given is only for St. Kitts only. And the other question, I noted that on the current special regulations, funerals are to be held within an hour time frame. What about the length of a regular church service, since some of these services last for up to 3 hours?
As Minister Phipps would have indicated in her presentation, the decisions that were taken today were taken by the federal cabinet. And so the schedule as it pertains to the resumption of schools applies to both St. Kitts and Nevis. While I am here, please allow me to make one slight correction in that the Clarence Fitzroy Bryant College will resume its classes on the 18th of January and not on the 24th. So Clarence Fitzroy Bryant College resumes on the 18th. With respect to the question on the duration of church services, the regulation did not place any restriction on the length of time church services can be held. However, restrictions are only placed on weddings and funerals, and these are restricted to 1 hour.
This is from Bucky Gottit Media. What are the plans taken for teachers and civil workers, civil servants, who refuse to get vaccinated without a doctor's report?
we got to 81% of adults with at least one shot, and 76% of the adult population being fully vaccinated by appealing to person's sense and sensibility and making sure that they come forward voluntarily to get vaccinated. We are still going down the voluntary route, but I continue to urge persons to do the right thing. If you are an essential worker, it means that you're offering an essential service, and we're just pleading with you. At some point in time, we might have to relook at how we approach this, but for now, it is still voluntary.
Does the date for the reopening of schools also apply to the private primary schools? The schedule provided for the reopening of schools or resumption of schools applies to both public and private schools. As indicated, private primary schools, private primary and secondary schools. So private schools can reach out to the Office of the Chief Education Officer should they have any questions or need any clarification. But this schedule applies to both public and private schools across the Federation. Dr. Laws, this one is asking for statistics. Statistics in relation to the number of vaccinated, partially vaccinated, and unvaccinated who are affected with COVID-19.
I would refer the person posing the question to one of my slides, whereby I provided data pertaining to the cases we've identified between December 24th and January the 5th. We added 844 cases, and as I said before, we are still trying to ascertain all the data, but 54.5% of these 844 cases were vaccinated, 7.7% unvaccinated, but then there's missing data for about 38% of these cases. So this is work in progress. And in terms of those who recovered, 148 persons recovered within the same window or time period. And of these persons who recovered, 80% were fully vaccinated, 20% not vaccinated, and the average number of days to recovery was seven days. And in terms of symptoms, 52% of these cases reported symptoms, COVID-like symptoms, and 21 symptomatic. Again, all the data not yet in, 20 missing data for about 27% of the cases. So this is work in progress, but it gives you a good idea as to the vaccination status. Thank you.
Somebody wants to find out internationally, they are not testing to come out of quarantine. Does the same apply here? I could answer that, but go ahead.
I just want to remind persons of a statement we made here almost 2 years ago, that the World Health Organization said that in the management of COVID-19, there is no one-size-fits-all approach. And two, that the situation in the management is more mercurial, and so will change as time goes by, depending on the situation on the ground. But as it stands right now, one has to be tested to come out of quarantine. That situation may change as we move forward, but for now, you have to be tested to be released.
Von Radio would like to know, when can the island of Nevis see the commencement of car park testing at the Alexandra Hospital?
Again, I want to refer you back to my presentation when I said that Dr. Judy Nisbet and I have been in discussion. We are exploring the options in Nevis, and as soon as this information become available, it will be shared to, with the general public. Yeah, so it's being explored.
This is our ultimate question for today. It is rumored that the Pfizer vaccines now being used are expired. Could you provide the Pfizer vaccines date of expiry? And secondly, when will we get the next batch of Oxford AstraZeneca vaccines?
I think it's important for me to make certain positions abundantly clear, which we have made here before. And we said that under no circumstances the Federation of St. Kitts and Nevis will be using any expired vaccines. And so you can rest assured that any vaccines we will be delivering into the arms of persons will not be expired. With that said, the expiration date on the Pfizer vaccines, I think that is February 28th. And we will always attempt to have a fresh set of vaccines once we're getting close to the expiration date. We have more than a sufficient supply of vaccines. We need persons to come forward and get vaccinated. There is no waiting list to get vaccinated. And so instead of worrying about when we're going to get the next batch, I want you to help us to get persons to come forward so that we can use the batch we have now.
Thank you, Dr. Wilkins. That brings us to the end of our question and answer segment. I want to thank all who contributed today to the briefing. I thank the Honorable Wendy Phipps, the chair of the Disaster Mitigation Council, and the representative for Cabinet for sharing on the recommendations coming out of the Cabinet's meeting today. Additionally, I thank the Honorable John L. Powell, Minister of Education. Of course, on everyone's mind, especially parents and guardians, is the safety of children in terms of the reopening of schools. I thank the Chief Medical Officer, Dr. Hazel Laws, and I thank Dr. Cameron Wilkinson, our Medical Chief of Staff. Additionally, Superintendent Cromwell Henry, and we thank as well the Prime Minister for his presence here. And we thank the Permanent Secretary in the Ministry of Education also for his presence. We thank Michelle Rodriguez, the Public Relations Officer at NEMA, and we thank Dr. Marissa Carty, who is often working very hard behind the scenes, and Mr. AJ at ZIZ, and ZIZ in general for their coverage of these COVID-19 briefings, both on television and radio and social media. We thank you very much for your questions and, of course, for always tuning in to our briefings, as they're a key part of the education campaign with the management of the COVID-19 pandemic here in the Federation of St. Kitts and Nevis. Thank you very much, and continue to do your part in the management by adhering to the protocols. We will be back at some other point next week, Wednesday, hopefully for another briefing. Until then, take care. I am Les Roy Williams.